Continue discussions now about the COVID-19 vaccine. We'll hear now from frontline workers through the Democratic Nursing Organization of South Africa. Aviwe Mtila bringing us that. Aviwe, a very good morning to you. And yes, we've heard lots of criticism, government being criticized for missing deadlines, for not acquiring this quicker as well, and also saying, you know, there is no money when we know that there has been a lot of money squandered as well. So where we're sitting now, with the information we have about the vaccine coming here by April, what's DENOSA saying, especially on behalf of those frontline workers?
Criticism is still continuing, Yuveka, towards government for dragging its feet in securing the COVID-19 vaccine, whereas the numbers are increasing and the deaths are increasing of COVID-19. We heard just yesterday the numbers of positive cases being confirmed at the highest yet, just over the last 24 hours, while we hear that we'll only be securing that COVID-19 first batch in April. I am joined by DENOSA's provincial secretary just to get their understanding of this whole process. Thank you, Bongani Mazibuko, for joining us at ENCA. But government's been attacked for being reactive in securing the vaccine rather than be proactive. What's your stance as DENOSA?
We actually do believe that, let me start with saying good day and thanks for the opportunity. Yes, government has been reactive in getting the vaccine. They could have foreseen that this is coming, and we believe that they being reactive and they are being so slow to act has actually resulted in us being only able to get the vaccine around the second quarter of the year, which is unacceptable if you look at the numbers that the people are dying and the infections that we've got currently.
Now, you represent healthcare workers, and of course the concern is that by the time that first batch arrives on our shores, there will be many more people dying, seeing that just over the last 24 hours we've received over 17,000 positive cases.
That's correct. It's a very high it's a concern, and it's a genuine concern to say that we cannot be having so many healthcare workers passing away and being infected with COVID-19, whereas we must wait until the second quarter of the year for 2021 for a vaccine. I mean, that really shows that if government is not going to be proactive and try and do something, we might not have a healthcare system to look after the people.
And do you believe that government is doing enough to protect healthcare workers?
Government is clearly not doing enough to protect healthcare workers. We firstly had issues with PPE. There were complaints about sizes, the standard of PPE, and now we've got not only that to deal with, but the delay in getting the vaccine. Other countries have already started implementing the vaccines that they've received, and maybe the president and his advisors need to do something more. Try and see how can they speak to Pfizer and all those other people, because the Pfizer vaccine was actually developed in South Africa. So maybe there should be some form of haste that is put to the negotiations in getting the vaccine sooner.
And in your negotiations with government, what are they saying in particular about dealing with the second strand of COVID-19 coming from South Africa? You mentioned that the vaccine was developed in South Africa, yet we're only receiving the first batch in April. What are the conversations like behind the doors?
Well, at the moment, the government is only going to be receiving the vaccine from the COVAX fund, which is a combination of other countries and other stakeholders. Now, if they were to continue, what we would like to advise would be for them to continue having bilateral conversations or engagements with the pharmaceutical companies, especially so that those who are vulnerable and our healthcare workers can be protected, so that we can continue having a healthcare system that will sustain and see us through this COVID period.
Thank you very much. Bongani Mazibuko, the provincial secretary of DENOSA, believing that government is not doing enough to protect its frontline workers and more, especially the healthcare workers.
Aviwe Mtila, thanks very much for that. Undoubtedly, the criticism will continue to pour in until we see that first jab arrive and be given here in South Africa.